Hey everyone, welcome to Billionaire. Today we are going to learn about top 10 things to know about guns sold out amid COVID-19 virus. Let's get started. The COVID-19 pandemic has caused a surge in gun sales. Estimates based on background checks show that an estimated 2.6 million guns were sold in the United States in March. That is an 85% increase over the same period last year. While there are no official numbers, gun stores in Canada have also reported increased sales. This has been spurred some news media to draw comparison between the two nations' gun sales spikes, potentially stoking the fears of the Canadian public. This angst has been echoed by gun control groups in Canada that have expressed concerns regarding the impact of increased access to guns on public earth. But few have noted the key difference between the American and Canadian COVID-19 gun sales spike. Now, the question to ask is, why are they buying? In the 1970s, only 20% of gun owners indicated self-defense as their primary reason for gun ownership. In the 1990s, following the explosion of laws that allowed Americans to carry guns outside the home, 46% listed self-protection. More recent studies have shown that 76% of gun owners now report protection as their primary motivation for gun ownership. The surge in first-time buyers suggests that many Americans buying guns during the pandemic are doing so due to the concerns about, number one, self-defense, number two, given fears of rotting, number three, violence, and number four, the government's capacity to deal with the crisis. With the absence of a gun carry movement in Canada, the same shift has not taken place. The conditions under which guns can be used by self-defense in Canada are narrow, and the government strengthening regulates not only firearms ownership, but the discourse surrounding guns. Self-defense is not a legal reason to acquire a firearm in Canada, and cannot be listed as a reason for firearms ownership on a possession and acquisition license or PAL application. Though no research exists at this time, owners of gun stores who were interviewed by the media noted that Canadians are likely panic buying due to a fear of shortage rather than a fear of violence, since the Canadian supply chain is heavily dependent on the United States. That means gun owners who may have waited to buy firearms and ammunition for target shooting over the summer or hunting this fall are buying them now. Now, another question to ask is, how are they buying them? This gives us to the 50th point of the things to know on guns sold out amid COVID-19. Number 5. Another key difference between the bump in sales in Canada versus the US is the requirement to purchase guns and ammunition. South of the borders, most firearm registration is made at the state level, with big differences in gun laws across the country. In many states, the only requirement to purchase a firearm from a licensed dealer is a federal background check, though states like California and Massachusetts have much stricter laws. In Canada, the bump in sales is limited to those who have already passed through the Royal Canadian Mounted Policies or RCMP extensive licensing regime. This process often takes up to 6 months and includes a weekend-long course, passing a written and practical test and reference checks. Canadian gun owners are subject to continuous automatic background checks as long as they hold the license. So, if somebody is legally purchasing a gun in Canada, it means the RCMP or Royal Canadian Mounted Police could find no reason why, in the interest of public safety, they should not possess a firearm. Now, another question is, who is buying what? Which gives us to the next point, that many of people buying guns in the US during COVID-19 pandemic reported that it was their first time purchasing a gun. Furthermore, the majority of guns sold during the current boom have been handguns rather than long guns. So it's a bit early to speculate. This could very well lead to even less support for gun control in the US, given that gun owners are unsurprisingly the least likely group to support gun control. In Canada, on the other hand, it is likely that only a small minority of guns purchased during the Canadian spike were first-time buyers, given the first time or given the time frame required to acquire a firearm license in Canada. Statistics on the breakdown of handguns versus long guns purchased during Canadian pandemic spike don't exist, but we can guess that most of the new guns purchased in Canada were long guns being used for hunting or sports shooting. No one knows. That's because gun owners wishing to own handguns must have a special restricted possession and acquisition license, RPAA, and maintain a membership at a shooting club, which can cost hundreds of dollars per year and limits handgun ownership to serious target shooters. Of Canada's 2.2 million licensed gun owners, only about a quarter have licenses that allow them to purchase handguns. And so it's clear that there are major differences between the gun purchase spike in Canada and the US during the COVID-19 pandemic. This will hopefully set anxious Canadian minds at ease and let everyone get back to focusing on more pressing problems. But in time of crisis, it is crucial to resist the impulse to make decisions driven by fear and anxiety. The threat possessed by the new coronavirus, which causes the disease COVID-19, is not the only relevant public health crisis to consider when deciding whether to buy a gun. Gun violence is already an urgent public health emergency in this country that takes the lives of nearly 40,000 people annually. Putting more guns in more hands is certainly exacerbates that problem. Now, another question is, why you should not buy guns in response to the COVID-19 pandemic? This is what I believe. When it comes to making the decision of whether to buy a gun, especially in a time of increased uncertainty and anxiety, individuals, families, and communities will be well served to ensure that these choices guided by data and research. Data-informed reasons to think twice before buying a gun during coronavirus crisis. This one leads to the seventh point, that a gun is more likely to be stolen than used in self-defense. Although guns are often promoted by the National Rifle Association or NRA and members of the gun industry as a necessary tool for self-defense, the available data suggests that defensive gun use is actually relatively rare. Data from the National Crime Victimization Survey, NCVS, demonstrate that from 2010 to 2018, individuals used guns defensively is less than 0.5% of all criminal incidents. Research also finds that using a gun in self-defense is no more effective than taking other types of defense actions in stopping or minimizing the impact of crime, such as using other weapons or calling for help. However, while guns are infrequently used in self-defense, they are routinely stolen. Data from the NCVS show that from 2010 to 2018, victims reported close to 1.4 million incidents of gun theft. Guns are therefore twice as likely to be stolen than they are to be used by self-defensive purposes. This is not a minor concern. Stolen guns create a significant risk to public safety in American communities. Once they are stolen, they are often legally trafficked and used in the commission of violent crimes. A recent analysis of the Center for American Progress estimated that from 2012 to 2017, more than 1.8 million guns were stolen in the United States. Number 8. Unsecured guns in the home create risk of unintentional shootings by children. An estimated 4.6 million children in the United States live in homes where guns are unsecured, meaning they are not locked with a secure locking device or in a gun safe. And while many parents think their young children do not know that there are guns in the home or where they are stored, far too often children do in fact know how to gain access to these guns. One study that separated interviewed parents and their children found that while 39% of parents thought their children did not know where their guns were stored, 73% of children under the age of 10 actually knew the storage location, contradicting their parents' perceptions. According to Everytown for Gun Safety, from 2015 to 2019, there were more than 1,600 unintentional shootings by children under the age of 18, which resulted in more than 600 deaths and 1,000 gun-related injuries. Most of the victims of these unintentional shootings were also minors, and most of these shootings occurred in the home, raising increased concern at schools across the country because and children are spending more time at home. Number 9. Guns are the most lethal means of suicide attempts. Social distancing or isolation is the key public health response to slow down the spread of COVID-19, helping to avoid a spike in cases that overwhelmed the healthcare system. However, social isolation can also exacerbate the risk factors for suicide, including feelings of anxiety, despair, and helplessness. Adding guns into that equation heighten the risk of fatal self-harm. Gun suicides account for 2/3 of all guns deaths in the United States, and guns are the most lethal means by which suicide is attempted. The use of a gun in a suicide attempt ends in death 85% of the time, compared with 3% death rate when other means are used. The deadly role of guns in suicide attempts is compounded by the fact that 90% of people who survive on attempting to end their lives do not go on to die by suicide, and 7% of suicide survivors never attempt to end their lives again. Number 10. Guns in the home increase risk to victims of domestic and family violence. For victims of domestic and family violence, the need to remain at home and practice social distancing to slow the spread of COVID-19 can heighten the risk of serious injury or death. Advocates for domestic violence survivors have warned that this isolation may exacerbate domestic violence. For example, abusive partners may prevent survivors from seeking medical care, further isolate survivors from their support system, or intensify their physical abuse and disruptive strategies that survivors have developed to keep themselves safe. Unfortunately, these fears are being borne out. In China, for example, the first country to experience COVID-19 outbreak, there has been a surge in domestic violence, while calls to police stations more than tripling in one count. And the risk of this isolation are particularly acute for individuals with disabilities, who are more likely to experience intimate partner or family violence than those without disabilities, and also face abuse from caregivers. The presence of a gun in households with the history of domestic violence can drastically increase the risk to survivors. Guns are often used by domestic abusers as a tool of threats, intimidation, and physical harm. When a gun is brought into a home experiencing domestic violence, A woman is 5 times more likely to be killed than if a gun were not available. Data from the FBI indicate that 1 in every 2 women murdered in the United States is killed by an intimate partner, and half of those murders are committed with a gun. Guns are also frequently used by abusers to inflict non-fatal harm. In the United States, for example, an estimated 4.5 million women have been threatened with a gun by an abusive partner. Now, here is the takeaway. The bottom line is that decision to purchase a gun should be made deliberatively, informed by all the available data and research. The question of whether bringing a gun into a home is a safe or appropriate choice for household involves as much monthly analysis than what is generally offered by organizations such as the NRA that purport to represent the interests of gun owners. And this decision is even more difficult during the period of unprecedented fear and anxiety related to the COVID-19 pandemic, when nearly every aspect of our life has been thrown into chaos. But regardless of what choices are ultimately made, it is crucial for all guns to be stored securely in order to prevent against theft and unauthorized access, especially by children and individuals who have been experiencing suicidal thoughts. Thanks for watching.